He's here with us today, and thank you again. Now, what procedures are available, and which one would you know is the one that you should choose? Is that more left up to your doctor on their advice, or is it your choice?
Well, there's many options available for weight loss surgery, and it certainly would be tailored to your particular situation. And the best person to make this decision, it's actually always a collaboration, as it is in medicine in general, but it'd be a collaboration between the patient and the weight loss surgeon. There are people whose specialty is weight loss surgery, and there's quite a few of them who work here in Corpus Christi, some who are here all the time, and others who come here for a large part of the week. So once you've gone through all the other recommendations that we have made, such as lifestyle changes, eating more appropriately for you, and of course exercise, and these two don't seem to work, and the medications have actually been prescribed and that doesn't work, then the next step would be to attempt weight loss surgery. And
some of these surgeries are, we've heard of gastric bypass, the lap band. Is this what we're talking about? Are there other things?
That's right. There's three main types of surgery, and it all depends on your particular situation. How overweight are you? Do you have diabetes or other problems associated with being overweight? And so this is gastric bypass. And all these surgeries are done laparoscopically now for the most part. Gastric bypass, there's something called a gastric sleeve, and then there's also the gastric band. And you want to go see a surgeon who has all three in their armamentarium. Somebody who could give you the gastric bypass should you be a candidate for that, or a gastric sleeve should you be a candidate for that. So this person will have an in-depth discussion with you. You will meet them more than once, and depending on what's the best option, you can go ahead with that surgery. But again, the surgery is just one step. You still have to make those lifestyle changes. You can't just get the surgery done and go back to living life the way you used to before. You still have to eat better, and you should exercise more as well.
That's what I was going to ask you. Once you have that surgery, can you just continue to eat the way you were eating? Because I think I've heard of people that have busted these bands from just continuing to eat the way they did.
You can defeat it. You can defeat weight loss surgery. That's why the most important thing is first that you want to lose that weight. You have to want to lose the weight. And what the surgery does is it's a surgical way to kind of enforce that lifestyle change choice that you have made. You can think of that.
And these aren't just regular people that are having these surgeries. I've heard of doctors having them.
Sure, anybody's overweight. First, obviously, you have to be overweight to be a candidate for this surgery. And once you're overweight, and if you've gone through all the options and none of them have worked for you appropriately, and then you go and talk with your weight loss surgeon, and if they think you're an appropriate candidate, then you certainly can. We have, politicians on the national stage who have had this done, many physicians and surgeons who have had this done. So certainly there's a whole lot of people who've had it done and have had good success.
A lot of people with weaknesses for food.
That's right.
That's right. Seems like what it is. Now remember, if you have a medical question that you need answered, please let us know by sending us an email or Facebook message. We'll get your concern to the doctor, and it may end up being the focus of one of our segments.